Hi, it's so good to be here again. So in today's video, I'll be teaching us how to pass a fine bore Nasogastric tube. This is a talking station in Oski and it is 8 minutes. It is a very simple procedure. So I'll just talk us through what is expected of us. Alright, so the first thing is the position. So you have to position this patient in a semi-upright position, and you put a pillow behind the head just to ensure that the patient does not lean too far backward nor too forward. You arrange a signal with your patient, do a sniff test to ensure that the nostrils are patent, and then you're going to ensure that you do a next measurement, that is measuring the NG tube from the nasal bridge to the earlobe and then to the cephasternum. And usually the normal pH should be equal to or less than 5.5. All right, so in this procedure, in this station, the assessor is going to tell you that you should assume that all the pre-checks has been done. So let's go. All right, so assuming all the pre-checks has been done, I'll go ahead to read my scenario. Daisy Jones, admitted on account of intestinal obstruction, had a surgery 3 days ago and she's having poor oral intake. The dietitian has recommended an NG tube insertion. Okay, so I go ahead to do my hand hygiene following the 7-step technique of WHO for hand hygiene. I put an ample of gel in my hand, I rub palm to palm, palm to the back of my hands, vice versa, fingers interlocked, vice versa, fingers interlaced with palm to palm, my fingertips in rotational manner and vice versa, my thumb in rotational manner and vice versa, my wrist in rotational manner and vice versa, and I allow my hands to air dry for 30 seconds. Now my hands are dry. Assessor, could you please confirm that this tray is ready for use? Yes. Okay, thank you very much. So I've got the NG tube here, the fine bore NG tube, and it's intact. It's expiring 2026. Okay, I've got the purple syringe and Terra feeding syringe. That's a 60 ml and it is expiring 2027. I've got the adherent dressing tape. It is safe for use. I've got the pH strip. It's intact and it's expiring 2026. I've got a kidney dish and there's a jug of warm water to lubricate the NG tube. Alright, so I'm just going to be opening this entire syringe slightly for easy access. And I open the NG tube as well for easy access. So I'm going to do my hand hygiene again, following the 7-step technique of WHO for hand hygiene. I allow my hands to air dry for 30 seconds. I don my apron. I don my glove. I'm going to take my tray to the patient's bedside. Hi Daisy, are you okay?
Yeah.
All right, so like I said earlier, I'm here to pass a fine bore nasogastric tube just because you've not been eating very well, and this will help us to ensure that you get the required nutrients that you need. Is that okay?
Yeah.
All right, so this is not going to take long. It's just about 8 minutes, but I'm going to arrange a signal with you just in case you need me to stop while doing the procedure. So you can raise your right hand, then I will know that you need me to stop. Is that okay?
Yes.
Okay, so and I'm going to be doing a sniff test now. Can you please block your left nostrils and blow out from the right? All right, good. And can you block the right and blow out from the left? Yeah, brilliant. I can see that both nostrils are patent. So I'm going to be sitting you up in a semi-upright position. Is that okay?
Yes.
Yeah, so I put this pillow just to ensure that you don't lean too backward, not too forward. Now, I'm going to be doing a next measurement now. So I take my NG tube. So I'm going to be measuring. So I measure from the bridge of the nose to the earlobe and then to the cleavage sternum. All right, so this is about 45 centimeters. So I'm going to be adding 5 centimeters to that. Like I said, you can add 5 to 10 centimeters. So I add 5 to that, so that is about 50 centimeters. And I ensure that I've gotten all the resuscitative equipment ready, just in case I'm going to need that. All right, so I'm going to be lubricating the NG tube in warm water. So I'm going to lubricate about 15 to 20 centimeters, okay, in warm water. All right, so I've lubricated that. So I'm going to be passing the NG tube now, Daisy. This may be a bit uncomfortable, but like I said, if you need me to stop, just raise your right hand, then I will know that you need me to stop. Is that okay?
Yeah.
So I'm going to be passing the NG tube. I'll be using your left nostrils. So I'll be passing it backward and inward. Can you please swallow for me? Yeah, well done. Keep swallowing. I can see there's no obstruction. If there's any obstruction, I'm going to stop and I'm going to try it with the other nostrils. And I keep observing Daisy for any sign of breathlessness or excessive coughing. I can see there's no sign of breathlessness, no excessive coughing. So I keep passing until it reaches the 50 centimeter indicator on the NG tube. So I keep going. Yeah. Are you okay, Daisy?
Yes.
Yeah, I know it's uncomfortable, but we're nearly done. All right, so that is 50 centimeters. I'm going to put my kidney dish very close here, and I place the end of the nasogastric tube in the kidney dish. So I'm going to use the adherent tape now to secure the NG tube. So I place it on the NASA bridge. Are you okay, Daisy?
Yes, Nurse.
Alright, we're nearly done. I'm just using this tape to secure the NG tube so that it doesn't slip out. Sorry about that. Are you alright?
Yes, Nurse.
Yeah, I can see there's no sign of breathlessness, so I'm happy. Alright, so we've secured the tape, and I'm just going to get an aspirate from the NG tube. So in your exam, an aspirate is going to be provided. Alright, so I've gotten the aspirate, and I ensure that I close the cap back, the NG tube cap. I ensure that I put it back. Okay, so I'm going to be checking the pH. So I take one of the strip, alright, so I take one of the strip, and I'm just going to be pouring the aspirate on the strip. Alright, and I'm going to be comparing it with the color codes on the pH strip container. So I'm going to be comparing it with the color code on the pH strip container. Alright, so the pH is 4.0. I'm happy with that. That shows that it is in the stomach. So I'm happy with the pH of 4.0. Are you okay, Daisy?
Yes.
Alright, so Daisy, the NG tube is in the right place. So we are going to be feeding you through this NG tube. I'm proud to every feeding, we ensure that we still check the placement. It's at 50 centimeters on the entrance of your nostrils, and the pH is 4.0. But before each feeding, like I said, we'll be ensuring that it's still at the same centimeters, and we'll check if the pH is still within the normal range. Like I said, the pH should be equal to 5.5 or less than 5.5. Another additional investigation that we can carry out to ensure the NG tube is in place is by doing a chest x-ray, just to be sure that we got the NG tube in the right place. But I'm happy with this NG tube. So I'll be leaving you now, Daisy. Have you got any questions for me, any concern?
No.
All right, so I'll leave the call bell here for you just in case you need anything. You can always press the call bell. Thank you so much for your cooperation, Daisy. So I'm going to ensure that all the equipment that I've used, I discard the ones that I need to discard and the clinical waste bin, and those that I need to make clean, I make them clean for next use. And I'm going to be removing my apron and my glove, and I discard in the clinical waste bin. I go ahead to perform my hand hygiene again, following the 7-step technique of WHO for hand hygiene. I put an ample of gel in my hand, I rub palm to the back of my hands, vice versa. Fingers interlocked, vice versa. Fingers interlaced with palm to palm. My fingertips in rotational manner, and vice versa. My thumb in rotational manner, and vice versa. My wrist in rotational manner, and vice versa. And allow my hands to air dry. Thank you so much for watching. Wish you all the best in your exam. Bye.